Before we begin, let me ask you a simple question. When was the last time you actually thought about your liver? For most people, especially after the age of 60, the answer is probably never. We think about our heart when we feel chest pain. We worry about our knees when climbing the stairs becomes difficult. We notice our eyesight when reading becomes harder. But the liver is different. It can quietly lose its ability to function without causing any pain at all. That is why liver disease is often called a silent illness. Every week in my clinic, I meet older patients from different parts of India who tell me exactly the same thing. Doctor, I felt completely normal. I never imagined there was anything wrong with my liver. Some came only because a routine health checkup showed abnormal liver tests. Others discovered fatty liver while having an ultrasound for an entirely different reason. Many had no pain, no serious digestive problems, and no warning they could recognize. The truth is, their bodies had been giving them warning signs for months, sometimes even years. They simply did not know how to recognize them. As a gastroenterologist, I've learned one important lesson after caring for thousands of patients. Your liver may stay silent, but your body rarely does. Modern medical research has shown that fatty liver disease, now one of the most common liver conditions worldwide, often progresses quietly before noticeable symptoms appear. By the time many people realize something is wrong, significant liver damage may already have developed. This is especially important in India, where fatty liver disease has become increasingly common because of diabetes, excess body weight, insulin resistance, unhealthy eating habits, and a sedentary lifestyle. Many people who develop fatty liver have never consumed alcohol regularly. That surprises families because they still believe liver disease only affects heavy drinkers. Today, we know that is simply not true. One reason liver disease is so difficult to recognize is that the liver itself contains very few pain receptors. Unlike many other organs, it does not usually send pain signals when damage first begins. Instead, it continues working quietly, compensating for the damage for a remarkably long time. But although your liver is silent, it is not invisible. It leaves clues on the outside of your body. These clues often appear gradually and in a fairly predictable order. The earliest signs suggest your liver is beginning to struggle. The later signs can indicate more advanced disease. And the final warning sign I will share today is a true medical emergency that should never be ignored. In this video, I will walk you through 8 visible warning signs that you can check yourself. We look at your eyes, your skin, your hands, your nails, your muscles, and other parts of your body that many people overlook every single day. By the end of this video, you will know which changes deserve attention, which ones should prompt a medical evaluation, and when you should seek help without delay. So please stay with me until the end, because the last few warning signs are the ones that families most often mistake for just getting older, when they may actually be signaling serious liver disease. Before we continue, I'd like you to leave a comment with the word liver below. I always enjoy hearing from viewers across India and around the world, and your comment also helps this important information reach more people who may need it. Now, let's begin with the very first place where your liver often reveals that something is wrong, and it may be staring back at you every morning when you look into the mirror: your eyes. Before we move on to the next warning sign, I'd like you to do something that takes less than 30 seconds. The next time you stand in front of a mirror, don't just look at your face. Look carefully at your eyes. In my experience, they are often the first place where your liver quietly reveals that something is wrong. The first warning sign is yellowing of the whites of the eyes, a condition known as jaundice. Many people believe jaundice only appears when liver disease has reached its final stage. That is simply not true. In its early stages, the color change can be so mild that only a family member notices it. Your spouse may say, "Your eyes don't look as bright as they used to." Your children might notice it while taking a family photograph. Because the change happens slowly, you may not see it yourself. I still remember a 6-9-year-old retired bank manager from Ahmedabad who came to my clinic only because his wife insisted. He smiled and said, "Doctor, I feel perfectly healthy. She keeps telling me my eyes look a little yellow." He had no pain, no fever, and no major digestive complaints. He almost cancelled his appointment because he thought it was nothing serious. But his blood tests and ultrasound told a very different story. His liver had been under stress for much longer than he realized. So why do the eyes change color first? Every day, your body naturally breaks down old red blood cells. This process produces a yellow pigment called bilirubin. A healthy liver removes bilirubin from your blood, processes it efficiently, and sends it into the digestive system so it can leave the body. When the liver begins to struggle, bilirubin starts building up in the bloodstream. One of the first places it settles is the white part of the eye because this tissue contains elastin, a protein that attracts the pigment. That is why the eyes often turn yellow before the skin does. This is one simple habit I recommend to many of my older patients across India. In the morning, stand near a window with natural sunlight on your face. Gently pull down your lower eyelid and look at the white of your eye. Do not rely on the warm lighting in your bathroom, as it can hide the early yellow color. If you or a family member notices that the whites of your eyes are no longer bright white, don't dismiss it as aging. It deserves a proper medical evaluation. Now let's look at the second warning sign: changes in your skin. As bilirubin continues to increase, the yellow color may gradually spread from your eyes to your skin. You may first notice it on your face, around your mouth, on your chest, or even on the palms of your hands. This is not a normal part of growing older, and it is certainly not caused by spending too much time in the sun. But liver disease can affect your skin in another way that many people never connect with their liver. It can cause persistent itching. Almost every month I meet patients who tell me, "Doctor, my skin keeps itching, especially at night, but I don't have any rash." Many have already tried different creams, herbal oils, and medicated soaps without finding relief. That is because the real problem is not in the skin, it is inside the liver. When the liver cannot move bile normally, substances that should leave the body begin circulating in the bloodstream. These substances irritate the tiny nerve endings in the skin, causing intense itching even though the skin may look completely normal. The itching is often worse on the palms of the hands and the soles of the feet, and for some people it becomes so uncomfortable that it interrupts their sleep. Some patients also develop darker patches on the face or the backs of the hands. Families often assume this is simply sun exposure or aging, but when these changes appear together with yellow eyes or persistent itching, they should never be ignored. Please don't make the mistake I see far too often in my clinic. Many people wait because there is no pain. Unfortunately, liver disease does not wait. If you notice yellowing of the eyes, yellow skin, or unexplained itching that lasts for weeks, arrange a medical checkup. Simple blood tests and an ultrasound can often identify the problem before irreversible liver damage develops. These first two warning signs are only the beginning. The next clues are even more specific, and surprisingly, they can appear right in front of you every single day. Your own hands may already be telling the story of your liver, and that's what we'll examine next. Now, let's look at a part of your body that many people never associate with liver disease: your hands. Every day in my clinic, I shake hands with my patients before we begin talking. While they think I'm simply greeting them, I'm already observing something important. Your hands can reveal valuable clues about your health, and sometimes they tell me that the liver has been under stress long before blood tests confirm it. The first change I want you to look for is called palmar erythema, or unusually red palms. Hold your hands in front of you with your palms facing upwards. Look carefully at the fleshy area below your thumb and below your little finger. In healthy hands, the color should be fairly even across the entire palm. But when the liver has been struggling for a long time, these two areas often become noticeably red, while the center of the palm remains much lighter. I often hear patients say, "Doctor, I thought it was because I worked outdoors, or I've had these red hands for years, so I never paid attention." That is exactly why this sign is so often missed. One patient I still remember was a 7 1-year-old retired grocery shop owner from Chennai. During his visit, his son mentioned that his father's palms had looked unusually red for several years. The family assumed it was simply the result of decades of hard work. The gentleman himself had no pain and felt reasonably well. But when I examined him more carefully and reviewed his tests, we discovered that his fatty liver disease had quietly progressed much further than anyone had expected. So why do the palms become red? Your liver does much more than digest food. It also helps regulate hormone levels, including estrogen. When liver function declines, these hormones are not broken down as efficiently as they should be. As a result, the tiny blood vessels close to the surface of your palms widen, producing the characteristic redness that doctors recognize immediately. This is not usually an early warning sign. It often develops after months or even years of ongoing liver stress. That is why I tell my patients never to ignore persistent changes in the color of their hands. You can even perform a simple check at home. Press gently on the red area with your thumb for a few seconds. The redness should fade while you are pressing and return quickly after you release the pressure. Although this does not diagnose liver disease, it is another reason to arrange a proper medical evaluation if other warning signs are also present. Now move your attention from your palms to your fingernails. Healthy nails usually have a soft pink color with a small pale half moon near the base, but in some people with advanced chronic liver disease, almost the entire nail becomes pale or milky white, leaving only a narrow pink or reddish band near the tip. Doctors call this Terry's nails. Many older adults assume these nail changes are simply part of aging. After many years of treating liver disease, I can tell you that this assumption causes many people to delay seeking medical advice. While Terry's nails can also occur with other medical conditions, they are a well-recognized physical sign seen in people with advanced liver disease, particularly when significant scarring of the liver has already developed. The change happens because chronic liver disease alters blood flow and the connective tissues beneath the nail bed, changing the way light reflects through the nail. It is not a cosmetic problem. It is a visible clue that the body may be struggling internally. Please don't look at just one sign in isolation. Doctors never do that. But if you notice yellowing of the eyes, persistent itching, unusually red palms, and pale nails appearing together, your body may be giving you several pieces of the same message. Take a few moments today to examine your own hands carefully. You may notice changes that have developed, so gradually they escaped your attention for years. If these explanations are helping you better understand your health, I invite you to subscribe to the channel. Every week, I share practical science-based advice to help older adults protect their liver, digestive system, and overall health before small problems become serious ones. But your hands are not the only place where liver disease leaves its mark. The next warning signs become even more concerning because they show that the disease is beginning to affect your blood vessels and your muscles. These are changes that many families across India mistake for normal aging, when in reality they deserve immediate medical attention. We've already looked at the warning signs that can appear in your eyes, your skin, your palms, and your nails. The next two signs concern me even more. By the time I see them in my clinic, I know the liver has usually been under stress for a long time. These are not simply changes on the surface of your body. They tell us that liver disease is beginning to affect your circulation, your hormones, and even the way your body maintains muscle. Let's begin with spider angiomas. Many patients point to these tiny red marks and tell me, "Doctor, I've had these for years. I thought they were just part of getting older." That is a very common misunderstanding. Spider angiomas are small, bright red spots with delicate blood vessels spreading out from the center, almost like the legs of a spider. They are most commonly seen on the upper chest, shoulders, neck, and sometimes the face. They usually don't hurt. They don't itch. They don't bleed. Because they cause no discomfort, most people simply ignore them. I still remember a 8-year-old retired engineer from Bengaluru who came to see me because he had been feeling more tired than usual. While we were talking, I noticed several spider angiomas across his upper chest. His wife immediately smiled and said, "Doctor, those little red spots have been there for years. We thought they were caused by the sun." They had never imagined those harmless looking marks could be connected to his liver. Further testing showed that his fatty liver disease had already progressed to significant fibrosis. Those tiny red spots had been quietly telling the story long before he developed obvious symptoms. So why do they appear? As we discussed with red palms, one of your liver's many responsibilities is regulating hormones, including estrogen. When the liver can no longer break down these hormones efficiently, tiny blood vessels near the surface of the skin become permanently widened. That is what creates the characteristic spider-like appearance. One or two spider angiomas alone do not necessarily mean liver disease. Some perfectly healthy people have them. But when you notice several appearing together, particularly alongside yellow eyes, red palms, or Terry's nails, they become a much more meaningful warning sign. Before we continue, I'd like you to leave a comment with the words "healthy liver." I always enjoy reading your comments. And they help more older adults discover this information before silent liver disease progresses unnoticed. Now, let's look at another warning sign that families often mistake for normal aging muscle wasting. This is one of the changes I explain to families almost every week. They often tell me, "Doctor, he's losing weight, but he's eating almost the same." Weight loss itself is not always the real concern. The important question is where the weight is disappearing. One of the liver's essential jobs is producing proteins that help maintain healthy muscle. As liver disease becomes more advanced, that process becomes less efficient. The body gradually begins breaking down its own muscle tissue to provide energy. At the same time, muscles become less effective at helping the body handle waste products such as ammonia, placing even greater strain on the body's metabolism. The first place I often notice this is around the temples. The sides of the forehead begin to look hollow, making the face appear older and more tired. Next, I look at the muscles between the thumb and index finger. In healthy adults, this area feels full and rounded. When those muscles begin shrinking, the bones and tendons become much more obvious. A few months ago, I treated a 74-year-old retired farmer from Punjab. His daughter told me, "Doctor, we thought he was simply becoming weaker because of his age." But when I examined him, the loss of muscle around his temples and hands immediately caught my attention. His liver disease had already begun affecting the way his body stored protein and maintained muscle. Fortunately, because his family sought medical care when they did, we were able to begin treatment and make important lifestyle changes before his condition progressed even further. This is why I encourage families not to judge health by the number on the weighing scale alone. If someone is becoming noticeably thinner, weaker, or losing muscle without trying, especially together with the warning signs we've already discussed, don't dismiss it as just old age. These changes tell us that the liver is no longer struggling silently. It is beginning to affect the entire body. And now we come to the final two warning signs. These are the ones that worry me the most because they can indicate advanced liver disease requiring urgent medical attention. Every family should know how to recognize them. Before we finish today, I want to show you the final two warning signs. These are the ones that concern me the most because they often appear when liver disease has already become advanced. If you or someone in your family develops either of these signs, please don't wait for them to improve on their own. They deserve prompt medical attention. The seventh warning sign is ascites, which means a buildup of fluid inside the abdomen. Many people mistake it for simple weight gain or bloating after meals. But ascites is very different. Instead of excess body fat, the abdomen gradually fills with fluid because the damaged liver can no longer maintain normal blood flow and protein balance. One reason this happens is portal hypertension, which means the pressure inside the large vein leading to the liver becomes abnormally high. At the same time, the liver produces less albumin, an important protein that helps keep fluid inside your blood vessels. As these changes develop, fluid slowly leaks into the abdominal cavity. I often hear patients say, "Doctor, my trousers have become tighter, but my arms and legs seem thinner." Others tell me they feel unusually full after eating only a small meal or find it difficult to bend forward comfortably. If you lie flat on your back and your abdomen remains unusually swollen or feels tight rather than soft, especially if your belly button begins to protrude, this is not something to dismiss as ordinary aging or gas. It needs medical evaluation. Early treatment can often prevent further complications, but delaying care allows the problem to become much more difficult to manage. The eighth and final warning sign is called Asterixis, sometimes described as a flapping movement of the hands. I'd like you to try a simple test. Stretch both arms out in front of you, bend your wrists back as though you are signaling someone to stop, and spread your fingers. Hold that position for about 30 seconds. If your hands remain steady, that's reassuring, but if they suddenly drop for a fraction of a second before returning to position in an irregular flapping motion, this is not a normal tremor. It may be a sign that toxins, particularly ammonia, are building up in the bloodstream because the liver can no longer remove them effectively. These toxins can affect the brain, leading to a condition called hepatic encephalopathy. People may also become unusually sleepy, confused, forgetful, or have difficulty concentrating. If you ever notice this flapping movement together with confusion or unusual drowsiness in yourself or someone you love, treat it as a medical emergency. Do not wait until the next clinic appointment. Seek urgent medical care immediately. Before we end, let's bring everything together. The most important lesson from today's video is that your liver usually becomes silent long before it becomes painful. That is why learning to recognize these visible warning signs can make such a difference. We began with changes in the eyes and skin, then moved to the palms and fingernails, followed by spider, angiomas, and muscle loss, and finally the two most serious warning signs, ascites and Asterixis. Individually, these changes do not always mean liver disease, but when several appear together, they should never be ignored. I don't want today's video to leave you feeling afraid. I want it to leave you feeling informed and prepared. The encouraging news is that many liver conditions, especially fatty liver disease, can often be slowed, controlled, and sometimes significantly improved when they are recognized early. Regular health checkups, maintaining a healthy weight, staying physically active, controlling diabetes, eating a balanced diet, and following your doctor's advice can make a remarkable difference over time. In many Indian families, older parents rarely complain about their health because they don't want to worry their children. That is why family members play such an important role. Sometimes a wife notices yellow eyes. Sometimes a son notices weight loss. Sometimes a daughter notices swelling of the abdomen. Those small observations can lead to an early diagnosis that changes the future. If today's video has helped you better understand these silent warning signs, please give it a like. Your support encourages me to continue creating practical, evidence-based health information for older adults. And most importantly, share this video with your parents, your brothers, your sisters, your friends, or anyone over the age of 60. One simple share could help someone recognize a silent warning sign before serious liver damage develops. Thank you for watching. Until next time, take good care of yourself, take good care of your family, and remember, the earlier you recognize the warning signs, the better your chances of protecting your liver and enjoying a healthier, more active life.